Now, on to the academic core of our summit with Session 1, Digital Health and AI-Enabled Healthcare Technology. Thank you very much. This session, focused on leveraging technology for cerebrocardiovascular health, will be chaired by Professor Alison Noble from the University of Oxford and moderated by Professor Kenny W.Y. Chan, Director of COCHE. They will be leading the discussion later during the roundtable. But first, we'd like to welcome our first speaker, who's also the session chair, Professor Alison Noble. Technikos Professor.
All right, okay. I'm delighted to be here. Thank you so much for inviting me to give a talk. Yeah, I am a session chair, but I'm being timed, so Kenny's really in charge today. What I'm going to be talking about in my short slot is some work that I've been doing as part of COCHE with my team. And the title is AI-Enabled Ultrasound for Early Detection of Congenital Heart Disease or Heart Defects. And what I'm going to be talking a little bit about at the beginning is where AI-enabled ultrasound is, how it's developed over a period of time, and then go on to talk about how we're now using some of those advances to look at a really important problem, which is how we detect problems in fetal hearts. So in terms of AI, we hear a lot about it, and I wanted to touch on how the family of techniques have been transforming medical ultrasound, which is the area I work in. I've worked in the area for approaching 25 years. And it's really transformed. In the early days, it was very much driven by the applications, and there are some examples here, and also medical physics. And that was focusing on how do we get sensors better, driven by improving the ability to detect acoustics, looking at acoustic waves, for example, and developing smaller and smaller sensors. So we had advances in physics, and then subsequently advance in electronics that allowed ultrasound to go from being cart-based systems through to handheld devices today. And this all sounds great. It sounds like everybody should be able to pick up a probe and use it in clinical care, but it's not that straightforward. And it's because ultrasound is like having a torch in your hand and then exploring it inside the body. Unless you've been trained in how to move the probe, understand how to interpret the images, it's incredibly difficult to use the technology. The figure in the bottom corner is from 2019, and it's talking there about how handheld devices, it was perceived, would start to be used in some new areas. And where you might not believe in some of those points in time, what's important is that it wasn't just about the miniaturization of the tech, bringing down the cost. It was the fact that this could only happen if you added AI to the devices. And the AI is then providing some cues to the person who's picking up the probe in terms of how to move the probe and how to remove the data. So the challenge with ultrasound is that it's a complex process, and it's about the interaction of the human with the device. You're looking at the screen. And it's sort of non-trivial to be able to mimic those human-like capabilities that experts have and put that into a device or act as the interface. And it's this complex hand-eye coordination which distinguishes this from other areas of medical imaging, which is a lot more about reading and interpretation of data. And you're also interpreting acoustic patterns. And with deep learning particularly coming along, that's incredibly powerful base technology for recognizing complex patterns. What we've been working on is how we could use that technology combined with ultrasound data, particularly ultrasound video, to be able to come up with ways that can assist humans in decision making. So you can now divide ultrasound work into solutions that support highly skilled setting and solutions that support minimally skilled setting. And what distinguishes this is what the human does. In the highly skilled setting, which will be hospitals, clinicians will perform freehand scanning. In that case, the assistance you want from the AI is in terms of things like finding standard planes and image analysis on those standard planes that you've captured. And that's really automating what humans do today, or the experts do. The other interesting area that's developed is what I've called the minimally trained setting. And that is where you now apply sweeps in standard protocols, much easier to train for healthcare professionals. But that translates the image or video analysis problem into one of non-standard plane image analysis and video analysis. And it's those two that then have led to a number of advances. If we take the freehand scanning, the advances that have been adopted by, that have been enabled by AI can be divided into three areas. You have what I call sonography data science. We now have large volumes of clinical data. And so we can now look at things like, why is it hard to scan in certain clinical areas? And can we understand from that what the assistive technologies need to do? How long do clinicians spend, for example, on certain tasks? What is the cognitive load as you perform a task? That sort of suggests the areas in which we might be developing tools of the future. With that understanding, you can also look at assistive tech for clinical workflow. What's shown at the top, in fact, I might run it again, if it will let me go. In the top video, is an automated system that now assists a clinician as they're performing obstetrics ultrasound. And that's purely based on AI recognizing what's been detected in a video flow, and then rather than the human performing manual actions, you can now automate that so that the human has to do less key actions. We've also been looking at modelling how to simulate the whole process of ultrasound, which is this: you move the probe, by moving the probe you capture an image, the human is then gazing at the image, and then from that you can suggest how to move the probe. So you have this iterative loop of look at a screen, move the probe, recapture an image. Can you automate that with AI? So all that is really starting to now advance assistive tech to support clinical workflow. And then the latest wave of tools are thinking about, again, supporting things like video summarization. So if you've captured in a clinic, you've captured a complete patient scan, summarize that into an interesting short video with all the key diagnostic information captured. Or video, what's called video VQA, where you can ask questions of a video, and hence the doctor can ask questions like, did I acquire all the views? Please tell me what the gestational age of the fetus is from particular video, clinical video scans. So in this space, there's lots of activity today. It's supporting the workflow, it's supporting sonographers, reducing that cognitive load. The other area is thinking more about global health settings, is when you're working with obstetric suites. And here we've been working with minimally trained sonographers who capture the sweeps, which are simply moving the probe in straight lines. And from that, having captured the video, the analysis is automatically done by the AI. You can use this for gestational age estimation. That's estimating how many weeks pregnant a woman is. You can also develop this type of approach into risk assessment in pregnancy, for example, as an early basic scan to check the health of a pregnancy. All these are examples of emerging techniques. What we decided to do in our COCHE project is use the learnings that we've had from both working with sweeps and also some of the advantage of the advances that we've seen applied in the high-income setting, look to see if we could apply this in the context of fetal heart detection. This led us to propose what's called the CAFE study, stands for Clinical Artificial Intelligence Fetal Echocardiography endoscopy study. And here are just some facts as to why this is an important problem. Congenital heart defects, it's the number one birth defect. It's rare, but it's very important to be able to detect. It reflects about 1% of live births. The fetus has a heart problem, and that translates into a child is born with this condition every 15 minutes. And the real challenge with this is that we don't pick up a lot of these cases. And that's because but if you do an ultrasound scan, it's very difficult to be able to detect the tiny defects in a tiny little moving object. So it doesn't form part of conventional screening. And if you look globally, it's an incredibly important problem to detect. This is from 2017, but as you can see, there's the mortality rates in infants due to this is worldwide and is a major problem. With out of 1.5 million children born with CHD, 96% of those are in low and middle income countries. And so if we can't develop ultrasound scanning techniques, we're going to remain with this being a major undetected problem. So what is a congenital heart defect? It's structural and functional heart abnormalities, and it's the most common fetal congenital anomaly. And although I've got some examples here, so hypoplastic left heart syndrome is when you get an underdeveloped left side of the heart, and TOF is actually a much more complex condition. The problem you have is there are many examples, as illustrated here. They can be divided into what's called critical CHDs and major CHDs. But if you take the traditional approach that you might take in medical image analysis, which is design a tool to detect each of this, you're going to fall into problems. So we have to sort of think about this in a different way, of if the goal should not be to detect every condition individually, but to think about it as a screening problem, and I'll come to that in a minute. So it sort of to summarize, there is a major need to be able to look at congenital heart detection. This does require policy change, but you've got to start with as well thinking about technically how can you detect this condition. So what we've done is we've formed the team called COCHE. There is a core team. It's a mixture of, it's based in Oxford and led by myself and Aris Papageorgiou. It's a combination of an engineering team and also a clinical team. But importantly, it has collaborative partners at 5 hospital sites. 4 of those are based in the UK, and 1 of those is based in Australia. One of the reasons that we have so many partners is because congenital heart conditions are so rare. And it also allows us to build the database. We've divided our work into 3 streams. One of them is forming what we call the CAFE data library. This is the multi-site data where we've gathered from the 5 sites approaching 11,000 retrospective scans, so that's taken from hospital databases. And then we've been particularly focusing on a special scan which sweeps through the heart, which is easy to train. And we have about 1,500 of those scans now. And it's also a building library. We also have approaching 2,500 congenital heart disease scans. And that is critical for us to be able to think about how we can go about detecting these conditions. So along with thinking about the protocol for scanning and doing some clinical analysis, we've also been developing some tools that I'll come on to at the moment. These are focused on video analysis rather than image analysis. And underpinning them technically is developing methodology that's based on looking at spatial temporal modeling of the video to be able to perform the detection. I'll come on to that in a minute. And our 3rd stream of work is actually looking at specific congenital heart detection applications. In our early work, it was geometry-based, and then more recently, we've been looking at anomaly detection, which I will mention in a minute. So go through quickly 3 examples. The first work is on visual query-based video clip localization in fetal heart ultrasound sweeps. What we're setting out here is if you've acquired one of these sweeps through the heart, we want to identify video clips which are particularly looking at certain components of the heart. For example, the part where you're looking at the forechamber or the LVV or the LVT, which is what doctors will look at if they're assessing assessing the scan. And this allows then the sonographer to do a simple sweep, and then you can present them with that video clip to do the analysis. We've developed a number of architectures to do this, and what you can see on this slide is that we're starting to get very good results in terms of comparing the ground truth with the red is one of the algorithms in terms of being able to localize these video clips. So it's a tool that can help with workflow. A second nice example is some work recently published at MICI on annotation-free cardiac phase detection. As we scan through the fetal heart, one of the differences from adult heart is that you do not have an ECG, so you can't locate the end diastolic frame and the end systolic frame. And that's important if you want to be able to then look at a heart in one beat. And what was developed by Ying Yu, one of my postdocs, is a very elegant way to be able to do this from unsupervised data that's based on the idea of a latent motion space, that you learn some features, you map into a motion space, and from that you can characterize these key endpoints. And it's led to an ability to be able to have what we call explainable cardiac phase detection, which might be useful in future for heartbeat segmentation, video clip selection, and also looking at pathologies, because you can now know which point in the cardiac cycle you are. And the final example is some work that was presented last week at NeuroWIPS on ultrasound video anomaly detection. Here, the key idea here is to take lots of examples of normal heart video sweeps, learn what those video sweeps look like, and then you can, if you've got a heart that has a defect in it, you would flag that as being out of distribution. This again is based on carefully learning about the temporal dynamics as well as what constitutes interesting features in an image frame. And then from the whole video, being able to have video clip level detection of whether that video clip is typical of what you'll find for a normal heart. And we're getting some promising results, although we really need to be able to look more at the congenital heart, the specifics of the congenital heart conditions we can detect. And we're doing some analysis of that at the moment with the latest database of congenital heart conditions we have. So just to summarize then, what I presented is some of our early results and early work that's looking at incredibly hard problem of doing congenital heart condition. We've created a large, very rich multi-site data, and we've been developing the basis of algorithms that can analyze this type of special video sweep. What we're now doing is assessing the suitability of these types of technique for fetal heart screening in secondary and primary care settings, with the view to translate to clinical settings as the next step. And what this work really exemplifies is how, as an example of ultrasound image analysis that's been enabled by large-scale data capture and deep learning, how it offers some really new exciting potentials to advance using ultrasound imaging in practice. Thank you very much.
Professor Noble, thank you very much. Please remain on stage. As a token of appreciation, we'd like to invite Professor Kenny W.Y. Chan to come on stage and present a souvenir to you.